Hi, HA International friends. Tony here at the 2020 HAE International Virtual Global Conference. We're making our way to pay a visit to the conference exhibit booth of our diamond sponsor, Takeda. And as we virtually walk up to the Takeda booth, we can see that Mary Eulenhop, Takeda's head of global advocacy, and Isabel Kolofanos, who is the company's product strategy lead for the HA portfolio, are here to speak with us today. Hi, Mary, and hi, Isabel.
Hi, Tony.
Hi, Tony.
Well, thanks for opening up your virtual booth to us and giving us the opportunity to ask you some of the questions that we're pretty sure you would get from HAEI friends who would visit your booth at the global conference. And first, we'll start with Mary. Mary, we understand that Takeda has a long-standing and very unique philosophy that informs the way the company conducts its business. Could you share Takeda's philosophy and principles with our HA International friends?
Thank you, Tony. I'd love to. Takeda is a 238-year-old company, and we're very grounded in principles of patient, trust, reputation, and business. We refer to this internally as PTRB. This reflects our patient-focused or patient-first culture. So patients are at the center of everything we do, and the way that we embed that is we make decisions and take actions by always putting the patient perspective first. This is essential to us achieving our main goal of providing sustainable access to medicines for patients worldwide. An example of putting this PTRB in action is the establishment of our recent Global HAE Patient Council. This is a tool or as a means of listening and testing our programs and our projects with members of the HAE community. And we're very pleased and proud to have HAEI and many of your member organizations represented on this council.
Well, thank you, Mary. That's quite an impressive philosophy and certainly one that has been developed over a long time, over 2 centuries. And moving over to Isabel. Isabel, we recognize that COVID-19 poses significant challenges to doing business. Now, do you foresee any impact on the continued supply of your HA medicines due to the pandemic?
Well, Tony, our priority during the COVID-19 crisis is to ensure that we will provide and supply the medicines of Takeda to the patients that rely on them. So at this point, we don't foresee any supply issues in the short term with our medications. In the long term, we continue to monitor the situation for these medications, and we will do everything possible to maintain the supply and ensure that the patients will have the medications that they need.
Thanks for that, Isabel. I think many in our community are perhaps breathing a little bit easier, knowing that that's the case right now. And moving back to Mary, who obviously is the patient advocacy global lead, this question really is right in that alley. And so how does Takeda, Mary, view the importance of working with patient advocacy organizations?
Thank you for that very important question. As I've articulated with PTRB, patients must be at the forefront of everything that we do. And our close collaboration with organizations such as HAEI and their member groups is absolutely essential to everything that we do. In order to achieve the best for our patients, we need to all be working together, patient organizations, the scientific community, and the industry together. We believe that early engagement is important to ensure that our work is truly in the best interest of patients. This is why we place such a focus on fostering listening opportunities and supporting compliant interactions from innovation through in our research through to the way that we deliver medicines in countries. So it's critical that we collaborate very closely with organizations.
Thank you, Mary, and we really appreciate all of the efforts that you put into supporting patient advocacy. Now, the next two questions for Isabel, and the first one is, Isabel, could you share Takeda's vision for HAE in the coming years?
Thank you, Tony. HAE is a priority area for Takeda, and we remain committed to drive innovation in this area. First and foremost, we want to ensure access to medicine to our patients, and we'll continue to partner with health, with you, and with the different governments to ensure that as we bring medicines to more geographies, patients will have access to our medications. We are also fully committed to raising awareness on HAE diagnostics, and we're working in many initiatives to improve that. We also would like to congratulate you on all the effort for HAE that HAEI is doing with A-Care. We think that's an important initiative that will have a significant impact for the community. To further support these efforts, Takeda is involved in a variety of educational activities. For example, you are familiar with our Global Forum, where hundreds of physicians come every year and participate in learning more about HAE. We continue best practice. We'll also soon will be launching an disease awareness campaign that will help us identify additional patients and help physicians around the world better understand the signs and symptoms of HAE. We also see that diagnostics and testing will improve with the initiatives that Takeda is driving forward. We are placing a significant focus on personalized health. We want to ensure that more patients have access to our medicines, but also that more physicians understand the condition and really understand the importance of that personalization in the treatment of HAE. We had launched recently an app, My HAE app, which we also hope will help us drive real world evidence and awareness of the disease. So overall, our commitment to HAE is significant and will continue to drive forward many initiatives community and advance science.
Well, it's quite a comprehensive program that Takeda is pushing forward for the HAE community. Certainly awareness is always key, leading to diagnosis, and then providing therapy for patients is something that all of us are looking forward to make sure that our community has access to and reimbursement for therapy. And we really were looking to work with everyone to do this on a global basis. The other component of the program that you guys have that I think is very important, Isabel, is your clinical trials. Could you give us an overview of the ongoing clinical trials sponsored by Takeda?
Sure, Tony. We are currently committed to advancing the clinical studies in various areas. The first one is pediatric population. We are advancing that. We understand the unmet need in that area is still high, and we want to continue providing therapies to younger HAE patients. We are also working on a new indication for one, and that study has started, and it will also enroll patients with acquired angioedema. We hope that will help in the future better understand the disease for those patients and will provide access in the future.
Very impressive, I must say. Well, we're coming to the end of our virtual visit here at the Takeda booth. And so, Mary, I'm just going to kind of put you on the spot here and say the floor is yours. Is there anything you'd like to say to the global HAE community as we wrap up here?
Thank you, Tony. There's so much we have to say and perhaps not enough time to say it all, but we especially would like to thank HAEI for your continued collaboration with us on so many different programs. We could not do this without you. It's so important for the broader HAE community to work together, as I've said before. In this disease area, patient organizations, the scientific community, and the industry have to work together in order to see a brighter future for people with HAE around the world. And we look forward to continuing this partnership. We really had been looking forward to seeing all of you at the conference this year in Frankfurt. However, we look forward to the next opportunity to see you all again. And until then, we continue at Takeda to show our support for all of you and all that you're doing by joining in the remote celebration for HAE Day. Staying resilient is so important at the moment, and we're championing our HAE Day activities through this theme. We're encouraging all of our employees to take part in the virtual global walk, and we're very pleased that Takeda will be adding our Takeda steps to contribute to the official grand total that you're pulling together. So with this, we just want to say thank you again for your collaboration, all the fantastic work you do, and wish you all a very happy HAE Day. And we hope that you're all staying safe at home, and we look forward to seeing you very soon, we hope. Thank you.
Well, thank you very much, Mary and Isabel, for providing us with the opportunity to visit with you today at the virtual booth. And we also appreciate all that Takeda does to support the global HAE community.